Groundbreaking practical research involving coronavirus and a breathing thermal mannequin. Using a breathing mannequin, one of a kind in Australia, named Laura, together with an inert tracer gas that simulated microscopic SARS-CoV-2 aerosol, tests were conducted to evaluate the impact of ventilation at the Australian National Maritime Museum in Sydney by Ashok Nathwani, Professor Richard Didier, Dr. Jing Xiong. The following tests involve the use of theatrical smoke to visualize the dispersion patterns in the exhaled breath of the index patient, i.e. mannequin. Zero, minimal, and maximal ventilation, mannequin wearing different types of masks. In this test, the ventilation was turned off, hence no fresh air was introduced into the room. As can be seen, the exhaled smoke rises above and mixes with the room air. The concentration level appears to be reasonably dense. In this test, a normal mask was put on tightly and then loosely. There was obvious leakage, especially around the nose when the mask was loosely fitted. In this test, a surgical mask was put on. There is a noticeable level of reduction in leakage.
And the idea of a breathing thermal mannequin is to simulate the effects of the human body and the respiratory system on the emission of aerosols that we now know to be the main transport mechanism or pathway for infection in COVID-19. So the idea of the thermal mannequin, to begin, is simply a showroom dummy named Laura, and she has a skin temperature that is very close to yours. And the purpose of that warm skin surface is to simulate the convective plume that we all have rising above our body, and that convective plume interacts with the breath that we emit and maybe carries some of the aerosols that we were just talking about into the broader space.
Australian National Maritime Museum was selected as a venue since it has a variety of indoor spaces, including a theatre, cafeteria, and a foyer area with a very high ceiling.
Sensor locations in the theatre were 1 seat down, 2 seats down, 3 seats down, and 4 seats down from the mannequin, and 2 sensors adjacent to the mannequin. At each measuring station, the concentration values increased when the air conditioning was turned on and decreased significantly with air conditioning on full fresh air economizer cycle.
It became evident that the virus was rising above head height into the large ceiling void of the entry foyer.
So in the test, we are using the mannequin to represent a real person. So the first challenge we encountered is how to set up the real pulmonary rate.
Yeah.
For example, it's inhale, exhale, and then pulse. So we need to use exactly the same breathing cycle.
All distances of the sensors were measured from the mannequin. At all sensor locations, the concentration values increased uniformly with no ventilation and decreased significantly when the door to the outside was opened and decreased further when the air conditioning was turned off. Key findings. The virus in the microscopic aerosol form stays aloft in indoor air for a considerable period of time, depending on the quantity of fresh air introduced, either through natural ventilation or via the air conditioning system. While the 1.5 meters social distancing rule indoors was originally conceived to minimize infection risks posed by larger SARS-CoV-2 droplets from sneezing and coughing, these tests demonstrate that it may be less effective in limiting airborne infectious aerosols emitted from an index patient who is simply breathing or talking. Indoor venues with large air volumes and high ceilings, for example, entry foyers, places of worship, shopping malls, social halls, etc., potentially have lower virus concentrations, provided there is no interference with indoor airflows from mechanical ventilation systems or fans.